Hey everybody, welcome to Pick Dr. Osborne's Brain. If you are new to the show, we answer your questions. If you've got questions, hopefully I've got answers for you. We're going to be talking today, a continuation of our conversation from Tuesday. If you missed Tuesday's show in my interview with Dr. Neil Nathan on mold, I highly recommend you go back and watch it. It's full of pearls and gems that if you're dealing with mold or mold-related inflammation or illness, it's something you're not going to want to miss. Now, before I dive into your questions today, I'm going to take a little bit of time to talk about detoxification from mold toxicity. I think this is a topic of conversation based on the questions that you've already sent in that I can tell many of you are confused about. And so I want to do a little bit deeper dive, impromptu dive today for you, so that you have a better understanding when you ask about detoxification, what we're actually dealing with and talking about. So let's dive into some mold detoxification basics. So in doing that, and those of you who don't know, moldjacked.com is now live. It's your new home for all things mold. If you're looking for information about mold, highly recommend that you check that website out. Let's see, get this thing off my screen. How do we get this thing out of here? Sorry, no, I goofed this up.
The tab there.
That was just here?
Yeah.
Okay.
Yeah, there you go.
Thanks.
Yep.
Oh, here we go. All right. So let's understand mold detox in a little bit better of detail. So number one, we have to understand that how mold affects people so that you can understand what you're actually trying to accomplish. So you can be allergic to mold. Many people are. As a matter of fact, research shows that approximately 22% of people of the general population are allergic to at least one type of mold. Now, mold allergy, you don't need to detox from because there's no detoxification. There's no buildup of toxic compounds or chemicals. This is just simply an immune response when you get exposed to mold spores. Very similar to when you might go outside during, ragweed season, if you're allergic to ragweed and you're having allergic type responses, watery, teary, itchy eyes, sore throat, mucus production, sneezing, coughing, wheezing, allergy symptoms. So we have kind of classic mold allergy. And the reason I even bring this up is because so many doctors mislead patients in this regard. They say if you don't have a mold allergy, then mold is not a problem. And that's just not true. In my opinion, mold allergy is a problem, but it's the least of our problems as it relates to what we call mold detoxification processes. So that's number one, get you some clarity. Number two, you can be exposed to the microscopic particulate that mold produces. So mold produces chemical compounds. Oftentimes, some of these compounds are referred to as mycotoxins. Molds also produce what are called VOCs, volatile organic compounds. And dead mold, has what are called hyphal fragments. And this is when we talk about detoxification, this is the main area that we really want to focus and hone in on. It's the detoxification from the exposure to these chemicals that molds produce. So we're less worried about being allergic to the mold, more worried about the byproducts of compounds that mold can produce. Now, there is a third thing that I think it's important to understand here as well, is that you can have mold colonize your body. And there are a couple different ways that this can happen. Mold colonizations occur, we can use another word if you're familiar with this term, mycosis, which is another way of saying mold infection. Now, you can have an infection from mold that's growing in your home or growing outside of your body. That mold, those mold spores can traverse through your lungs into your body and colonize different areas. So a common place where we might get external mold colonizing in a human would be in the sinus cavities because it's quick access from the air. we'll see mold colonize the lungs as you breathe spores in. One of the more common examples of mold colonization or mold mycosis infection is a condition called aspergillosis. It's where Aspergillus mold spores start growing inside of you. Now, so now let me split this up a little bit more. So there's a mold infection from mold growing outside of the body that comes into the body, and then there's a secondary colonization that occurs. And this occurs because when you're exposed to number two, to the things in number two, the mycotoxins, the VOCs, the hyphal fragments, these compounds suppress immune function. So they reduce your immune system's ability to fully function. They also preoccupy your immune system. These chemicals, cause free radical damage and oxidative damage. So they use up a lot of the body's resources, weakening the body's immune system. And when the body's immune system is weaker, that's when colonization occurs, right? So think of this one as like stage 3. This is where it really can get bad. And when the outside mold starts to colonize internally into your body, that's problematic. But the other part of this is that when you're immunosuppressed, when your immune system is reduced, this can affect normal, what we call flora mold, or I'm going to give you a classic example. There's a type of yeast called Candida. Most of you probably heard of Candida, Candida albicans. There's multiple species of Candida, but Candida albicans is probably the most well discussed. This is a normal flora. Candida grows naturally in humans. Now, generally speaking, it's very well contained, meaning that we all have some small amounts of Candida, and so it's not really that much of a problem until that small amount of Candida blossoms, grows, and gets larger and stronger. Now, when we're immunosuppressed, this is when this can happen. This is when we get Candida growing out of control. But the other thing that you have to understand is that mycotoxins are antibiotics. So it's one of the side effects of mycotoxin exposure is they behave like antibiotics on your healthy bacterial flora. So your gut flora, your good bacteria, get hammered. They get wiped out. And when your bacteria are being wiped out, that leaves room and space for Candida to take the resources and to get stronger and grow. And this is also sometimes what we refer to as mold colonization. So 2 types of ways that mold can affect us in this number 3 category. One would be the actual mold growing in your home. You breathe it into your body, and then you're immunocompromised, and it starts growing in you and producing mycotoxins internally. That's a very dangerous situation. Mold growing in your lungs, for example, there's a 60% mortality rate with that. It's called aspergillosis. But mold colonization of the Candida variety is less life-threatening, but it doesn't mean that it's not health damaging. So think of it as the mycotoxins suppress the good flora, allowing for that normal Candida that's already in you to grow out of control. Candida can then start creating its own toxins. One of the toxins Candida creates is a type of mold toxin called gliotoxin, and that comes with a whole litany of other problems and issues. So back to the topic at hand, which is mold detox. What are we detoxing? You don't detox a colonization. This is not, you don't detox an infection. This has to be treated or dealt with, but it's not part of detox. Now, if you are colonized with mold, it's very important that before you implement a detox protocol, that you deal with this. Because if you've got mold growing in you or on you producing mycotoxins, and you're trying to take binders or other nutritional supplements or prescription drugs whose aim is to pull these toxins out of you, but you have your own internal growth factories of these toxins, you're never going to fully detox. And this is the mistake that we see a lot of people making, is that they jump straight to number 2. They jump right to, how do I get these toxins out of my body? Give me binders, give me pills. But they don't ask the question as to whether or not they have a mold infection or the mold colonized, or they're still in the environment where the mold is. So if you haven't moved out of the environment, you're still going to get continual exposure to these toxins and VOCs and hyphal fragments. So if your attempt at detoxification, if you're trying to do detoxification, but you're continually getting exposure, you're going to lose. You're not going to win. You're going to spend a ton of money on pills and doctor's visits, and you're still going to be sick, because at the end of the day, the number one rule to any detox protocol is not to retox. So you have to take care of the retox part, and that means either getting out of the environment or cleaning the environment. Secondarily, if you are colonized, that means cleaning this up first. So once you've taken care of your environment, you've taken care of any kind of infection or colonization, now we get to move into what we call detoxification. So let's talk about detoxification a little bit. So when we talk, what are we detoxifying? Well, we're detoxifying the compounds that we were exposed to when we were being exposed to mold. And so there's a few different things that we have to consider here. And one is something I'm sure many of you are already familiar with. It's the use of binding agents or binders. And so what binders do is what they sound like they do, right? They grab onto, they are polarized, and so they will bind to the different toxins, to the different mycotoxins and chemicals produced by molds. And this is done in the intestine, okay? And then from there, when you bind them, you can now poop them out. Where binders become necessary is something, there's a process in your body called enterohepatic circulation. It's when your liver produces bile acids combined with mycotoxins. They bind to them. They have a very high affinity for each other. And so what happens is you make bile, not for detoxification of mycotoxins, you make bile, predominantly we make bile to help us digest fat in our diet. So our liver produces bile, our gallbladder secretes that bile into the small intestine, and then that bile will basically emulsify the fat from our diet so that we can absorb fat-soluble vitamins like vitamins A, D, E, and K, and omega-3 fats, and other healthy fats that we're trying to get energy from and use as nutrients. So bile's job is not really to bind to mycotoxins, but if you are exposed to tremendous amounts of them, your bile is going to become saturated with them. And the problem with that is that in your intestine, you resorb the bile acids. You reuse about 90 to 95% of that bile is reabsorbed in your intestine and is reused by your liver. So if your bile is busy binding mycotoxins, and then a good percentage of that bile is reabsorbed, where does it get reabsorbed back to? Back to the liver. So you're just bringing those toxins right back into your liver. It's a vicious cycle or circle. So again, that's called enterohepatic cycle. So entero meaning intestine, hepatic meaning liver. So it's going from your gut where you're trying to poop it out, but the bile binds to it and brings it back to the liver, so it keeps it in the body. We don't want that. We want that stuff out. And that's why binders are used. You bind the mycotoxins with the binders so that they can come out through your poop. Now that's one way we can detox, and that's why we use binders. There's a misconception that binders, that when you take them, that they're absorbed somehow into your bloodstream and that they're binding mold toxins out of your cells or out of your tissues. That's not what binders do. What binders do is they bind it in your intestines so that it can be extracted from your feces. And this is why when you're doing detox, it's extremely important to have good bowel movements. If you're constipated, your detox is going to suffer. So this is another very important rule around detoxification, is you've got to make sure your detox pathways are open and that your bowels are flowing. Now, one of the things that we use regularly clinically to keep bowel movements going, because what can happen when you're detoxing is constipation can happen, because these toxins are leaving you. These toxins are neurotoxins, and they can affect the vagus nerve and your bowel flow. So they can actually diminish your bowel movement quantity by stifling the nerve flow to the bowels. So we use vitamin C Vitamin C at high enough doses can act as an osmotic and pull water into your bowel and ensure that you're having regular BMs with detoxification. And the other reason why we like vitamin C is because it has antifungal properties. So if you've got at all any colonization, vitamin C is just helping your body. It's helping give your immune system what it needs. It's supporting that immune system's ability to fight. But vitamin C is also a chelator. And so as a natural chelator, it also has some binding capacity for these things as well. So we like vitamin C in that regard to keep those bowels, to keep that bowel support going. So that can be, this is one of those areas where a lot of doctors don't use this as part of their protocol, but I'm just telling you, if you're constipated trying to do detox, vitamin C may work really, really well to offset that. So binders work within the intestine to pull mycotoxins out of you. They don't work in your bloodstream to pull mycotoxins out of your tissue. Now, in your bloodstream, we like to think about how do you get the mycotoxins that are floating around and circulating in your blood, but also that are lodged in your tissues and your fat cells. How do you get those into the bloodstream and to the liver? Because that's what is necessary to get them out of you. Remember that mycotoxins themselves are fat-soluble toxins. They store in fat, travel on fat, and so largely they can deposit in fat cells. This is one of the reasons why when people are doing detox, if they're losing weight at the same time, if you're overweight and you've been living in mold and your body has punched and stored a tremendous amount of toxins into your fat cells, you start losing weight, you're going to start mobilizing toxins to the blood. Those toxins are going to come out and they're going to end up in your bloodstream. Now, from your blood, they have to travel. Ideally, they go to your liver, where they are manipulated into water-soluble toxins. So part of the liver's job is there's a process in the liver called biotransformation. And what that's really basically doing is it's taking this fat-soluble toxin and converting it into a water-soluble toxin. Why? These fat-soluble toxins are hard to excrete. They're hard to get out of the body. But water-soluble toxins, they can exit your body from your blood to your kidneys, so through your urine. They can come out through your sweat. They can also be dumped into your intestine and pooped out. There's some evidence that they can be breathed out. So the more water soluble we can make them, the easier we can mobilize these 4 routes of excretion, which is the goal. So you want your liver to be able to do this really well. Well, what is required by your liver to do biotransformation of mold toxins? Well, one of the main important ingredients is methylated B vitamins. This is why so many people in mold do really, really well with detoxification if they're getting adequate B vitamins. The B vitamins, the methylation process is a part of the detoxification that occurs with mycotoxins. And so this is done by B vitamins, predominantly B12, folate, and B6. There's also a role there, though, for vitamin B2 and others, but those are the main ones. So these, and you want to make sure you're doing it in the right form. You don't want folic acid, you don't want synthetic folic acid, and you don't want cyanocobalamin. You want methylcobalamin here, or hydroxycobalamin, either of those two, and you want methylfolate. And for vitamin B6, you want something called P5P. You don't want pyridoxine hydrochloride. That can pose problems. So when we're talking about detoxification, we don't want to give the body more work to do by taking in poor quality vitamins that aren't premethylated and that aren't bioactive. We want the right types of vitamins to accelerate or advance or support this process of biotransformation so that we can turn that fat-soluble toxin into a water-soluble chemical. So the B vitamins are very important. And there are other things that help the liver do this work as well. Things like glutathione and N-acetylcysteine, alpha-lipoic acid become very, very important in this role. There's also herbals like milk thistle or the active ingredient silymarin, which can help support the liver, because remember, as you're taking these toxins and transforming them through the liver, these toxins are doing damage. And so you want to protect the liver while it's having to work harder. And so this is where, with detoxification, if you just do a ton of detox support, but you're not actually protecting the liver, then the liver could struggle to help you through this. And what we'll see a lot of times when people are struggling is we'll see their liver enzymes. If you've ever gone to the doctor and had these two tests, AST, ALT, these enzymes will go up sometimes when you're detoxifying or when you're supporting detox but not supporting the liver. So you're accelerating the liver's detoxification capacity, but you're not actually protecting the cells of the liver from the thing it's trying to detoxify. And one of the best things to do here is NAC and alpha lipoic acid. Very protective in milk thistle. Pomegranate's also very good. Ellagic acid in pomegranate is very liver protective. Watercress is very liver protective. So these are just things that protect the liver as it's trying to transform the toxin. And so you have to think about these things in lieu of your process, because if you don't, what happens for many people is they go on this detoxification where they're giving or taking a ton of things that detox, but their liver's not being supported. And so then they have what's known as a Herxheimer response or a detox reaction. So they just feel awful. They feel horrible, much worse than if they weren't doing anything. And so that's part of what happens as you mobilize toxins out of fat and you put that pressure on the liver. You just want to make sure you're supporting the liver and protecting the liver at the same time, giving it what it needs to break them down, but also giving it the shields that it needs to prevent any kind of extraneous or increased damage. So this should be part of your detoxification protocol. Now, binders, we talked about binders earlier. There are a number of different kinds of binders, but in my opinion, and the research shows this as well, probably some of the best binders, there's really three, in my opinion, that work better than everything else, and that also have data to back up that they work. And that is, number one is charcoal. Number two is zeolite, which is a clay binder. And then number three is fulvic acid. So if we look at the types of binders, those three, my opinion, are the best. There are a lot of other binders as well. And you might have worked with a doctor who used, for example, bentonite clay. You might have worked with doctors who used okra and other like plant-based fibers as binders. You might have worked with doctors who prescribed you bile acid sequestrants like cholestyramine or other medications that are binders to ochratoxin A. That's predominantly what that particular class of medication will bind. But in my opinion, you have to be careful with prescription binders, because prescription binders themselves they reduce absorption of fat. And so that's vitamin A, vitamin D, vitamin E, vitamin K, and omega-3 fatty acids. And the problem with that, obviously, is the malnutrition component. You're taking high doses of a binder that causes malnutrition as your body's trying to detox, heal, and repair from years of inflammatory induced damage by toxins. And these nutrients are necessary to heal and repair that damage. So by blocking them, you could be slowing down your progress. So that's one particular element. But the other is, most of you that have been in mold, if you've heard this term, chronic inflammatory response syndrome, or CIRS, one of the primary hallmarks of this condition is chronic inflammation. And chronic inflammation is happening because the body shifts into inflammatory mode, because the air you're breathing on a daily basis becomes a poison. So your immune cells are primed to attack. And so that's what they're doing. And they get stuck in this attack mode. And one of the ways to shift what we call the resolution of inflammation. So inflammation ends with a process called resolution. If you don't get to this part here, you get stuck in this damaging aspect. So inflammation, where you're recruiting these types of cells like neutrophils that are secreting their chemicals all over your tissues, and this leads to inflammation and breakdown of your tissue. So this is the middle phase of inflammation, the way we want to think about it. And you want to get past this middle phase into this resolution phase. And what helps to do that is omega-3 fatty acids. So if you're using a binder that's, that's blocking your absorption of omega-3, you're going to end up in trouble with resolving the inflammation. So we want to get here because this is where your symptoms start to go down. This is where you start to get a gradual reduction in how you feel horribly, right? Because the symptoms of mold, we've done shows on that, but the symptoms of mold poisoning are quite vast. And it's because it drives inflammation. So it can cause inflammation in any tissue. It's a neurotoxin. It inhibits healing and repair and growth. Mold can damage your joints and your muscles and your tendons and your ligaments. It can damage your brain. Mold can damage your liver. So all that leads to just a plethora or myriad of different symptoms. But in order to resolve those symptoms, we have to resolve the inflammation. And the only way we resolve the inflammation is through omega and other nutrients. And if our plan to get rid of the toxins that are driving the inflammation is to reduce our body's ability to get those nutrients necessary to help us get on the other side, then we're putting a roadblock up in our way. And I think it's very important that you know that, because so many doctors love those synthetic binders as a means to pull mycotoxins out, and at very high doses for very long periods of time. It would be different if it's like, take this binder for a week. I don't think you're going to really run into many problems. But when you're on these binders for months on end and the dose is extremely high, is where you run into these vitamin deficiency issues that start to creep in. So going back to what we're saying, so detox is number one rule. You have to be out of the mold, or you have to have the mold out of you. Number two, binders to bind in the intestine to prevent the reabsorption of the toxins so that you can get them out of the body. But also you want to do things that help the liver to biotransform the fat-soluble nature of these toxins into water-soluble chemicals so that you can sweat them out, pee them out, poop them out, and breathe them out. So if we're talking about, we talked about using vitamin C to make sure your bowels stay moving. We talked about taking methylated B vitamins and other nutrients to help support and protect your liver. But the other thing that's important with detoxification that you can't forget is increasing your body's capacity to heal through increasing your sunshine exposure. Sunshine increases mitochondrial energy production. And we need energy, right? Healing is a very ATP-rich process. In order to repair damaged cells from years of mold exposure, we need more energy to do that. And one way to get free energy without food is sunshine. And this is, in my opinion, one of the most important things you can do, because when you're outside, you can kill three birds with one stone. One, you can get your sunshine and increase your energy production. And it's not even just the energy production, it's also the infrared, which has deep penetration into your tissue that helps you to sweat. And with that increase in sweat, you get mycotoxins leave the body, right, through sweating. So sunshine is your sauna. Some people go buy a sauna membership or go buy a sauna, but and depending on where you live geographically and what time of the year it is, but if it's summertime, this is free medicine. Tap into it, go outside and sweat. Your feet on the ground equals grounding, so that's another benefit. And grounding increases energy production by your body, helps your body generate energy more aggressively. It also increases healing time. So you can ground, you can get the red light and the sunshine, but you can also get fresh air. Fresh air, oxygen, very, very important, and a part of making energy too. So sunshine is probably one of the most important. You couple that with, we want lots of sweat. Saunas 3 to 4 times a week to tolerance. Saunas are always done to tolerance, 20 minutes of sweating, because the mycotoxins can make their way out that way. But we also want fantastic hydration, because one of the ways we detoxify is through our sweat. And if we're sweating, we're dehydrating. So we need to make sure we're keeping our fluids and electrolytes up. But the other thing this does, when we keep our fluid levels up, it increases our urine volume. And what comes out in the urine? Mycotoxins. So it's a way to detox through peeing. So you can get increased urine output of mycotoxins through adequate hydration. You can get increased mycotoxin excretion through sweat, from sunshine, from infrared saunas, or even exercise to tolerance. And so these are things that you can do that aren't pills, that don't cost you money, that don't require that you visit a doctor. These are just tools to heal that you have access to today. One of the questions that came in was, how can I figure out all these tests and all these things to do without a doctor? I can't afford a doctor. Well, mold toxicity is not a do-it-yourself at home project. I mean, this is years of education I'm spitting out at you, and I'm kind of condensing it into its simplest terms, but it's much more complex than what I'm showing you. And it's not, there's nuance to it as well. But these things are free. These things you can do at home, and you need to be tapping into them, because if you're not, you're missing a big chunk of how you can support your body to get through onto the other side. So there it is, a simple crash course in detoxification. We'll just sum it up. Get out of the mold, get the mold out of you, start binders to bind the mold from your mycotoxins from your intestine into your poop. You use liver support, things like methylated B vitamins, N-acetylcysteine, vitamin C, lipoic acid, glutathione are all very important to both help the liver to biotransform these toxins, but also to shield the liver from increased risk of damage. Lastly, you want resolution of the inflammation, and this is done through quality eating. If you're eating poor foods, if you're eating foods that are rich in mycotoxins, once you have been in mold for a long period of time, there is something called hypersensitivity, which is when your immune system becomes overreactive when you get exposure. And what happens is you get hypersensitivity to mycotoxins. And then you're out of the mold, so you're no longer getting aerosolized mycotoxin exposure, but you're getting foodborne mycotoxin exposure. And so this would be grain. You know, those of you that know me, no grain, no pain. This is part of why I wrote the book, was to discuss the issue of mold and mycotoxins in the food itself. So grain-free diet if you're trying to recover, because if you're hypersensitized to mycotoxins and you're eating a bunch of cereal or other grain-based products, you're never going to shut the immune system off. The immune system is going to keep reacting to the food that you're consuming. Coffee, alcohol, especially wine and beer. We also have things like dried fruit, can be highly mold toxin spoiled. Certain nuts, mainly peanuts, although technically they're a legume, not a nut, can be contaminated with aflatoxin and other toxins. But you want, avoidance of these foods that are going to keep your body hypersensitized to mold becomes an important part of your diet change. Obviously, you want to eat whole, real foods that you're not allergic or sensitive to, that don't offer up pesticides and other poisons as well, because you don't want to give your body more to have to fight when it's trying to recover and heal. So this has got to be part of your plan too, diet change. If diet change is not part of your detoxification protocol, you're not going to win. I've not yet seen somebody coming out of 10 years or 15 or 20 years of mold poisoning be able to recover from binders and liver support alone. Really, ultimately, at the end of the day, you've got to get the diet free of mold as well. So don't underestimate the power of diet change in that regard. Part of your strategy should also be increasing your sleep. Many of you coming out of mold are super tired and have chronic fatigue and diseases that are, or dysfunction that leads to a lot of fatigue and neurological brain fog. And so you're going to want to take naps. Many people, not all, but many have a guilt complex around naps. They think if I take a nap, I'm lazy. You've got to go into healing and repair with a different attitude. Sleep is a requirement. And if you're sleeping more while you're healing, fantastic. Make sure you take the time to get that extra sleep in. And so it may be more, it may be beyond the kind of the 9 at night to 5 or 6 in the morning. You may find yourself wanting to take an hour nap or wanting to sleep in and sleep late. Do so. If your body's telling you you're tired, you should take advantage of that sleep and get it, because this is when healing happens. This is also when detoxification happens. So you've got to tap into diet. You've got to tap into sleep. If you're not tapping into those, you're going to struggle more through your process. So how do we get from full blown feeling awful to feeling fantastic. I mentioned resolution earlier. Once you get these things out that are driving the hypersensitivity response, so I mentioned these foods here as being foods contaminated with mold toxins, but there are other foods as well. If you're allergic, mold toxicity causes food allergenicity to increase. One of the things that we see, especially if you're exposed to Fusarium zea, which is a type of mycotoxin, we see a condition called mast cell activation syndrome. This increases your mast cells, and you start becoming allergic to food. And people collect food allergies the way old ladies collect, those precious moments dolls. Anyway, I had an aunt one time who collected those things, but that's another story. You become hyper allergic to all foods. So sometimes getting tested, getting a food test, food sensitivity and food allergy testing done can help you really dial in your diet so that you're not accidentally exposing yourself to things that keep driving mast cell activation. Zea is an estrogen-based toxin, and this is one of the reasons why women are more affected, because estrogen stimulates mast cell dumping and histamine degranulation onto your tissues, which is what drives the process. So when we get rid of the Fusarium mold with the Zea and we get the Zea out of our body, we take away that synthetic estrogen action or that biotoxin estrogen action, and we calm our mast cells down. So one of the ways we can do that is we can do testing and we can remove the foods that are driving this. One of the other things that you can do for this is specifically if you're having a lot of problems with the mast cells from a detox perspective is you can use high-dose quercetin with vitamin C. And we use, in our practice, we use like 5 grams a day of vitamin C and about 4 grams, anywhere from 2 to 4 grams a day of quercetin for this right here. It stabilizes mast cell membranes, and so it makes it harder for those cells to secrete excessive amounts of histamine. So it, in a sense, it has a therapeutic benefit or can to support your recovery. And so those are just strategies if you're one of those mold victims that have had mast cell diagnosed and you're having histamine reactions to everything, consider this combination at those amounts to calm this down as you're also removing the foods that you're reactive to, removing the foods that have mycotoxins that you have hypersensitivity to. And what happens over a period of about 6 months is your immune system goes from this angry to being this angry, right? So everything just kind of calms down. And that's what we want. We want your immune system, when you're in a poisonous air environment, your immune system's on high alert and it becomes hypersensitized. And this is why you become hyperinflamed, because your immune system is just over attacking. And it's because it's not really even over attacking, it's appropriately attacking the toxins you're being exposed to. And in the process, it's doing bilateral damage to your organs and your other tissues. So if we can get the immune system to calm down by not exposing it to the things that it doesn't need to be exposed to, it's going to quit overreacting. And subsequently, what are we going to get? We're going to get reduced inflammation. And this is when we start feeling better. This is when our symptoms start to back off. And this is where resolution sets in. One of the other things I really like to use when helping somebody through this detox strategy is I like to use what are called SPMs. That stands for Specialized Pro-Resolving Mediators. These are fatty acid substances that shift the heightened inflammatory response. Remember I showed you earlier that neutrophils come in and they degranulate and they cause tissue damage. Well, we want to get past that stage. That stage is called resolution, and SPMs push us past that stage. And sometimes people feel better quicker using SPM to get to that resolved state so that their body's inflammatory response is just on a more even keel, more normal. So those are all strategies. We could talk for hours more, but I want to also spend a little bit of time today taking your questions. But I hope that that was helpful for many of you thinking about detoxification as a whole. So we're going to take a quick break, and then when we get back, I will start taking your questions. Alpha Max, a premium gluten-free antioxidant formula containing high-potency alpha-lipoic acid. Now, this supplement was designed to help support healthy antioxidant levels, healthy blood sugar, as well as healthy nerve function. What makes this formulation different than other alpha-lipoic acid supplements? Alpha Max has a patented slow-release formula for maximum absorption. I've also added the B vitamin biotin to the formula because ALA competes with it. Now, many people with gluten sensitivity and celiac disease develop gluten-induced nerve damage. Research has shown that using alpha-lipoic acid to be beneficial and safe for those with neuropathy, especially diabetic neuropathy. Additionally, ALA helps regenerate the antioxidants vitamins E, C, and CoQ10. Research has shown that ALA helps support blood sugar metabolism, helps increase the antioxidant glutathione, but also supports detoxification. Now, some of the key benefits of using alpha-lipoic acid are: number one, it helps generate energy for cells. Number two, it helps your body metabolize blood sugar. Number three, it helps your body metabolize branched-chain amino acids. Now, the suggested use for this product is 1 capsule at bedtime, but if you want enhanced performance, take 2 capsules a day in divided doses with food. Now, if you're under high stress or training, I advise 3 to 4 capsules a day for peak potency. Okay, welcome back. Let's dive into your questions. So Maria is asking, which vitamin C do you recommend and how much do we take? I'm partial. I have a blend of vitamin C. Most vitamin C in the US is synthesized off of mold. And that's one of the problems if you're mold sensitive. So vitamin C, they take bacteria or molds and sugar plates, and then they synthesize it from that. So we don't want that when we're hypersensitized to potentially to mold. It's not to say that that vitamin C will make everyone react, but I have seen people react to mold-derived vitamin C. So I have a brand called Detox, and it's in a powdered form. And I like powder because you're using high doses. At high doses, we're talking about 5 grams, sometimes even more, 5 grams a day. You can take 5 horse pills, or even in some cases, most vitamin C tablets are 500 milligrams, so you'd be taking 10 pills. But in a powder form, you know, one level teaspoon is approximately 3 grams. So you're basically taking about 1 3/4 of a teaspoon a day divided throughout the course of your day. And this is a non-mold synthesized vitamin C. It's also buffered with minerals, so it reduces acidity and works really, really well for what we're trying to accomplish with vitamin C, which is to keep those bowels moving, but also give immune support and a good source of vitamin C for that person that's trying to get through detoxification. Can you talk about, let's see, we'll come back to that. Does silver remove mold from the body? I mean, no. It's not anything I would think about using for that. I mean, definitely not something that I would put at the top of the list of supplementals that you'd want to use for mold specifically. How do we know when there's inflammation in the body? What tests? Oh, so Dinah's saying, well, how do we know if there's inflammation in the body with what tests? Is it necessary to test the cerebrospinal fluid to detect inflammation? No. I mean, I don't recommend spinal taps unless you are in a really dire strait. I mean, that's a pretty invasive test, and you're popping through to get spinal fluid. That kind of testing doesn't come without risk, Diana. But I would say, as a general rule of thumb, there's several tests that can help you to detect inflammation. One would be C-reactive protein. Another would be ESR or SED rate. There's VEGF, and there's transforming growth factor beta, TGF beta 1 specifically, that can be used to help to detect mold-related inflammation. There's MMP9 that can be used to detect mold-related inflammation. And then, of course, there are other variable tests that help to isolate and identify whether or not you're being exposed to mold specifically. You have to understand that inflammatory tests aren't definitive for why you have the inflammation. They're just telling you that the inflammation is there. Ultimately, you want to, if you're inflamed, you usually know it, right? Because you hurt or you have the symptoms associated with it. So the bigger and more important question really to answer in those situations is what's driving the inflammation. I'm DIY mold removal, ceiling to floor, dehumidifier and windows open, respirator for bad areas, 5% acid, white vinegar, and disposable rags. Is this a good start? You know, any removal is better than no removal as long as you're protecting yourself as you're doing it, and it sounds like you are. You should be wearing a respirator in all areas when you're doing remediation, and you should also be looking at if you're not already using a Tyvek protective suit to reduce some exposure in that way as well, and gloves and boots. Just protect your whole face, all of your breathing holes, so to speak. So if you're wearing a respirator, make sure it covers your eyes and your nose as well. But I mean, you can, depending on the nature of, so remember, if you're doing remediation, the first thing that you have to understand is where's the mold. So you have to remove it, right? But the most important question is, why did the mold grow? And that needs to be determined, because mold grew in your home for a reason. And usually that reason is moisture. There's either excessive moisture for whatever might be going on. You might have a defect in a wall. You might have a sprinkler hitting the side of your house too aggressively for too long a period of time, leading to moisture accumulation. You might have no fans in your bath vents, leading to, when you take a shower, leading to excessive accumulation of moisture. I mean, there's just a lot of potential reasons, and you need to backtrack where that moisture, that excessive moisture is coming from, because that's why the mold grew in the first place. But, so removing the mold becomes important, and then wiping down the areas that didn't have visible mold but had the potential to be contaminated with the dust of mycotoxins. That's another strategy, using HEPA vacuums, using negative air pressure with air scrubbers. We're getting ready to release a document. My plan in the next month is to sit down with one of the best mold remediators and actually have a candid conversation, at one that's applicable for all of you at home watching, that will help you to understand the process of remediation better, what works and what doesn't. So be prepared for that. It's coming. But getting out of them, if you can't leave the home, controlling moisture, cleaning what you know is there, yeah, it's always a good start to try to reduce it. The question mark will be, is reducing it going to be enough to restore health? I only have minor ochratoxin levels, yet I have immense lower extremity pain, tendon issues, skin lesions, feel hyperhidrosis, skin hypersensitivity, and so much more. Yeah, so depending, Colton, on how you were measured, if your ochratoxin levels were measured from your urine and you're only seeing mild amounts, here's one of the conundrums. Sometimes we see this. It's not very often, but it does happen. Is somebody has liver damage. So liver's been damaged. And so remember what I said earlier is that the toxins, the mold toxins, come into the liver and they're biotransformed into water-soluble toxins that can be excreted. Simple, right? So what happens with mycotoxins sometimes, if you've been in it long enough, is those toxins are damaging your liver. And so now your ability for your liver to take those toxins and turn them into water soluble and excrete them is reduced. And so now when you do a test, a urine test, you don't see as much as what is actually there. So like, because this process is being hindered, you won't see as high of an amount that's truly representative of your exposure. That's a potential. Now, sometimes in these cases, what we do clinically, and if you've got a test and maybe you've done it through a doctor, talk to your doctor about this, but you can do a provoking test, provocation, using glutathione or NAC. And generally, it's anywhere from 500 to 1,000. milligrams of this, and make sure it's a liposoluble glutathione, so a fat-soluble glutathione. And if it's NAC, you need approximately 2,000 milligrams a day. And you want to do this provocation. You want to take these for at least 3 to 7 days prior your urine test. And by doing that, you'll give that liver a reprieve, and you'll accelerate its ability to do this, so that you'll see more coming out. And we see this, again, it's not a super common affect for people, but sometimes I'll give you an example. I once had a patient who there was visible mold in an area of their home. So we knew their house had a mold problem, and their mycotoxin levels just didn't match the visible mold that we saw in the house. And this person also had liver damage. So like other blood tests that we had done showed elevations. I mentioned this a minute ago, but elevations in ALT and AST indicating that the liver was damaged. And so we knew that. And so it made sense. So you can do provocation, and you can get a truer read in a case like that. That's an example where I don't like to provoke people's livers to excrete more mycotoxins as a general first step. And there's a reason why. I'm really, when you provoke toxins out, sometimes you get historical storage versus current or ongoing exposure. And I would rather not use a provoking agent to measure, to do the test. But in cases where there's liver damage, we will use a provoking agent to determine whether or not that's happening, so that we don't miss something that's actually worse than what we think it is. Anyway, I hope that gives you a little bit of context for what you can do, because it may have something to do with your immense lower extremity pain and tendon issues. Because I mean, mold definitely, ochratoxin A, I've seen it do that to people, where did it to me. And when I was in mold, I didn't have it wasn't my lower extremities, it was my upper. My shoulder was just shot. I couldn't do pull-ups. I couldn't do push-ups very well without intense pain. I mean, it just hurt all the time, and I never injured it. So, but yeah, I mean, that could be mold. If you've gone through the rheumatology gambit, they're going to want to put you on biologics, or they're going to want to put you on steroids. They're going to maybe do the autoimmune markers, depending on the doctor you see. But you got to figure out what's triggering that. If you haven't read No Grain, No Pain, that's something else you should consider. Because you can get ochratoxin A. If you're a heavy coffee drinker, you can also get ochratoxin A coming out through coffee. And so you may not have mold in your home, but you may be getting exposure to low amounts through your food, but you may be gluten sensitive. I mean, autoimmune arthritides are very commonly triggered by gluten. So if you haven't explored gluten as a potential, go read my book, No Grain, No Pain. Is it okay to take a PPI for acid reflux for a month to control acid reflux? Why a month? Now, I'm not trying to pick on you, Wanda, but why a month? Do you have acid reflux? Did you actually have a pH endoscopy where they measured? Do they see physically acid coming up from a broken valve, and so it's truly acid reflux? Or because most of the symptoms of acid reflux are the same as not making enough acid. Or you could have food allergies that are mimicking the symptoms of acid reflux, in which case PPIs are all they're going to do is cause malabsorption of nutrients. They cause B12 and magnesium and calcium deficiency, and then you're going to end up anemic, and it's just downhill from there. So you got to get a definitive as to whether you truly have an acid problem, or whether you have not enough acid, or whether you have a food allergy that's causing irritation to the gut, that's allowing for regurgitation and irritation to your stomach and esophagus. Or whether you have a bacterial infection in your stomach that's eroding the mucosal layer that makes it hurt when you make your own acid. That's not acid reflux. Those are all different mechanisms, and you should have that conversation with your doctor to rule the different things out. Just had my right leg swollen from my knee down to my ankle due to a skin infection, which I was given Augmentin, and I finished with it. My leg is still slightly swollen, but the infection is gone. Could be vascular or loose condition. Any suggestions? Protein. Make sure you eat enough protein. And when you're trying to recover like that, especially post-infection, you definitely got to get your protein levels up to really fully heal, especially with that swelling, because protein helps to regulate fluid movement through the body. The other thing, though, you were on Augmentin, so you need to be on a really great probiotic at this point. I recommend, we have something Freya called Ultrabiotic Defense. It's a strong, high-dose probiotic that's designed to take after you've taken an antibiotic to help support normal flora in your GI tract again. How can you tell if mold is colonized in your body? Edie's asking. Testing. I mean, you can, there's symptoms. So for example, colonization of the sinus cavities, you get sinus congestion, a lot of mucus production can be a symptom. Headaches, sinus pressure headaches can be a symptom of sinus colonization. For gut colonization of like yeast, overgrowth, it's, it can be a variety of different things, but intestinal bloating, intestinal discomfort and pain, diarrhea and or constipation could be symptoms. But outside of just symptom identification and speculation, the best way is to have cultures done. You can culture your sinuses. You can ask your doctor to do that. You can culture your gut. If you suspect aspergillosis, you need to get to a pulmonologist right away and get a sputum culture of your lungs and have an x-ray shot of your chest to rule that in or out. But those are the main ways. How to reverse psoriasis? Well, I mean, I don't know. It depends on what triggers your psoriasis. But psoriasis is an autoimmune condition of the skin, and typically it's also associated with the autoimmune attack on the spine. Psoriatic arthritis, if you will. And so the general categorical triggers of autoimmunity are food, microbes, nutritional deficiencies, and chemical exposures. So you have to rule those 4 categories out to get to the why, right? And everybody, that's true of anyone with autoimmune disease. Rule those 4 categories out. That's the starting place for the answer of how do I reverse my fill-in-the-blank autoimmune disease. What do you think about silicon dioxide and magnesium stearate in supplements? I think they're flow agents and they're relatively benign for the vast majority of people. What nutrient deficiencies can contribute towards autonomic dysfunction? There's a lot of them. Magnesium, B1, and choline are probably 3 of the most common that we see. What are your thoughts on taking itraconazole for mycotoxin fungal overgrowth treatment? I've been told binders aren't enough. Well, binders don't. So going back to all that I just talked about, Sherry, I don't know how to pronounce your name, but if you have mold growing in you, itraconazole is an antifungal and it can help with that. So I'm not opposed to it. You should talk to your doctor about that, whether or not that's something that you need to do. But binders are not going to do anything for a mold infection. Remember, binders bind mycotoxins, and they have nothing to do with the infection aspect of mold. So you want to separate those 2 things out in your mind as you're trying to get to your solution. Mold toxicity plus no savings or expendable income. How would you go about getting help? Derek, I would go get a tent and I would find a safe place that I could pitch it and I would recover. Because when you're in mold, if I don't want to make any assumptions about you, but I would imagine you're probably very sick and you can't work, and that may be why you have no savings or expendable income, because you're not functional. Many people in mold, that's what happens. But you can afford a tent and you can get outside and you can recover in fresh air. But what you can't do is stay indefinitely in this home that's slowly poisoning you, because it ultimately there's anything that you're going to do to succeed is going to cost money. But a tent is the cheapest solution, sleeping outside. And I've had a number of patients over the years that have done that very thing. They pitch a tent in their backyard or pitch a tent on some land and recover within the fresh air. But that's as free as it can get. But you've got to be willing to, depending on where you live, you got to be willing to brave the elements and, and forego some of the creature comforts of modern living. But to me, that's a no-brainer. If it were me, I would get out as quickly as possible. If I had no money, I would get a tent. I mean, I would scrimp and save and earn whatever I needed to get, $50 to go buy a tent, or I would just hang a sheet on a clothesline and sleep under it. If you see candida in live blood sample under a microscope, does that mean your body is removing candida and detoxing? No, if you see what you think is candida, so you don't know that it's candida, you can't look at a live blood sample under a microscope and say that's candida with a degree of 100% certainty. That's not to say that it can't be helpful, but there's a lot of anecdote with live blood sample analysis. And that's not to say people aren't helped by it or can't be helped by it and that it can't be a useful tool, but culture that blood for candida and anyway, if you've got candida in your bloodstream, you've got bigger problems. Candida is not something that typically traverses the bloodstream without severity of immunocompromisation. Let's see here. How do you support the activity of the microglia in your brain? Well, you just start by not poisoning them. Microglia respond to toxins that get through the blood-brain barrier, and this is when we start seeing a degradation, inflammation, and misfolded proteins that lead to bigger issues. So there's not like a supplement, hey, take this for microglial support. It's more of just a lifestyle strategy: clean air, clean water, clean food, exercise regularly, get sunshine regularly, go to bed on time, and get good sleep. In general, does vitamin C help with constipation? Yeah, it does. In general, it's very effective to help people with that. As a matter of fact, you're far better off using a vitamin C than you are with using one of these over-the-counter milk of magnesias or some of these other chemically loaded junk that you can buy in a local pharmacy. That, to me, that stuff, you're just poisoning yourself for the sake of having a bowel movement. Vitamin C, though, has other benefits. How to test for mast cells if they're reacting? I mean, you can test the blood. There's enzymes that you can measure, tryptase. You can measure histamine, and you can measure something called DAO. You can measure directly the immune, the blood differential, the white count differential can help you understand whether that's happening as well. Like that, Audrey says, 6 days grain-free and I'm already feeling better. Love it. 6 days, guys, 6 days. If you're new to the show and you haven't checked out No Grain, No Pain, start there first. That's like low-hanging fruit for any new visitor, is start with the 30-day diet. And especially if you've got autoimmune diagnosis, and you're going to feel better. I mean, generally, it's very rare that somebody does that diet with an autoimmune diagnosis and doesn't, in my experience. In Florida, over a month, tend to take 2 1-mile walks daily, AM generally before the heat picks up, and PM still hot. Yesterday, finally sweat, for sure, but not everywhere, just on the back, not salty. Keep doing it. You're chugging salt, but apparently it's not enough. Well, what can happen? I mean, there's a lot of reasons why you could take in a lot of salt but still not sweat. And with mold exposure historically, or slow detox, the people that have been overly, I'm going to use a layman's term here, this isn't the technical term, but overly toxified, let's say you're one of those people, the sweat mechanism is affected, and generally these people don't sweat very well, and sometimes it just takes consistency of getting the exposure to the sun, to the infrared, to the heat, and exercise to tolerance to build up. As you change your diet and sleep well and do the right things in your lifestyle, the sweat starts to come. And once it starts to come, you'll sweat regularly. And I'm not sure I understand your question, Larry, but you say, I had Aspergillus outer ear infection. I never knew Fusarium infected anything but plants. What is it like? Fusarium doesn't typically infect humans. Fusarium produces a toxin called zearalenone, which is a estrogen mimicking compound that you can absorb into your body through your skin and through your lungs or through contaminated food. And that once it builds up inside of you, that Zea, it causes an estrogen dominance to begin. So it's not a fusarium infection that causes Zea mycotoxin elevation. If you can't tolerate milk thistle, then don't take it. Detox is not a one-size-fits-all process. And I think this is where a lot of times when people try to begin a detox, they've gotten this protocol, right? And there's nothing wrong with protocols, but protocols are not one size fits all. Sometimes there may be, 5 or 6 or 7 things on a protocol to do, and you don't tolerate 2 or 3 of those things. Okay, if you don't, that's fine. Do what you can. Listen to your body. Detox shouldn't be a miserable endeavor where by doing it, you're sicker than by not. Do you recommend an ERMI test at all? I've already had mold remediation by a company and still have mold and still having health issues. I mean, if you had remediation and still have mold, my question, Colton, is where's the accountability to the remediation company? Because if you've had remediation at home, but you can still see visible mold, they need to come back out and fix that. Most remediations come with some type of warranty, depending on, I don't know what they gave you, but an ERMI test is a good test. It's a screening tool that can help you understand, from a dust perspective, what kinds of mold spores are in your indoor air environment. And generally, an ERMI should be done as a post-remediation clearance, meaning that you had remediation, and after the remediation was done, about 8 weeks later, you do an ERMI test to make sure that remediation is still effective, that there's not another source of mold or another exposure. So in that regard, ERMIs can be very, very helpful and useful. If you're struggling with milk thistle in the liver, then consider, instead of using milk thistle, consider just using NAC or glutathione as an agent in that regard. Because if again, there's more than one way to skin a detox cat. How do you diversify your skin microbiome? Own a garden and go outside and put your hands in the dirt and pet animals and be around animals, and don't have germophobia, and don't bathe in soap all day long 4 or 5 times a day. I know people that take 4 or 5 showers a day with, astringent soaps that wash off their microbiomes. I mean, you've got to let your body get some dirt on it. My friend Josh Axe wrote a book years ago. I think it was Eat Dirt, one of his earlier books. It's good conceptual understanding of how the immune system needs to get dirty to properly train and not overreact to the environment. Which supplement can I give to my son that targets all 7 toxins? Aluminum, mercury, thallium, antimony, tin, lead. I mean, maybe I'm not clear. It's hard for me to give you direct, Diane, because you tell me that your son has heavy metal toxicity of all 7 of those. If that's the case, I would, you could use lipoic acid, you could use NAC, you could use glutathione, you could use chlorophyll supplements, you could use some EDTA, but I don't know how old your son is, how much he weighs. There's a lot to go into that to answer that question properly. Is it possible for mold and yeast to form a synergism? Yeah, I was just talking about that earlier, Shalene. Mold exposure from the environment, mycotoxin exposure, causes microbiome depletion, which allows for yeast to overgrow. So there is that synergism. That's a very, very common pattern. And the way you deal with it is you get out of the mold. You make sure you've got probiotic to reestablish and to support good, healthy microbe balance, and to create competition for the yeast. And there may need to be the use of things, either natural antifungals or prescriptive antifungals. So That would be like caprylic acid and oregano would be on the more natural side versus, say, itraconazole or any of the azole antifungals on the prescription side. Let's see here. What all has to be removed from the home? You mean a moldy home? I don't understand if you're talking about remediation and you're asking what needs to be removed from the house permanently, it depends. I don't recommend trying to keep mattresses or fabric furnishings that can harbor deep into the cushions mycotoxins. But clothing can be washed. Hard surfaces can be wiped down, HEPA vacuum and microfibered. So a lot of things can be resolved or saved depending on the nature of the extent of mold growth on the item. If you've got an item directly with mold growing on it, like a wooden item, it's not something I would recommend that you keep, or a book. But like if you've got dishes in the pantry that that don't have active mold growing on them but are in a moldy home, those are the types of things that can be remediated. My MycoLab blood serum test came back with high T2 toxin for IgE antibodies. Would antifungals be the best method? No. So you're confusing an antibody reaction to a toxin to the treatment of a mold infection. And this is why I spent the first 30 minutes or so today defining those differences for you. You don't treat an antibody to a toxin with an antifungal drug. You treat the liver and its ability to properly mobilize and detoxify that toxin, because the toxin is driving the antibody. So you have to detox the toxin, and the toxin is coming from black mold. That's what T2 toxin is. It's from Stachybotrys. So you have to neutralize the source of the Stachybotrys in your environment and remove it so that you're no longer being exposed to T2 toxin. Then you have to support detoxification pathways to eliminate the T2 toxin out of your body. Itraconazole won't do that. Itraconazole is an azole antifungal that is designed to treat fungal infection. So it's two very different things. How can you fix the histamine reaction to mold and diet triggers and exercise? So, I mean, one of the best ways is I mentioned earlier, is quercetin mixed with vitamin C at higher doses. And you also might want to get your nutritional levels checked. Vitamin and mineral deficiencies, oftentimes, because the vitamins and minerals regulate histamine response, you can be deficient in particular nutrients that create histamine or histamine-like reactions because your body doesn't have what it needs to regulate. For iron overload situations, so you telling me that you have a history of iron overload, or that you're just concerned about it? Because if you just have a concern about iron overload with vitamin C, it's not a tremendous concern. So maybe clarify the question. But the way you dose vitamin C generally is you dose it, anywhere from 1 to 3 grams at a time. And then, so, if it's bowel tolerance, right? So you don't want to take all 5 grams all at once. You're probably going to run to the bathroom. But if you can tolerate 1 gram, okay, then 1 gram dose at a time, and split that dose out over every few hours. If you try to take more than that and you find yourself with super loose bowels, then you might just back off and split the dosing out over a longer spacing of time. I've been getting skin irritation, that itchy and on top of my eyelid when I go outside the park for my morning walks. I mean, it sounds like you could be having just an outdoor allergen. You might consider looking at, we have something called Histacyst, Salida. I'll put a link in for you. But it's a formula that mixes bromelain and quercetin and vitamin C and a few other ingredients that act as a natural buffer to histamine. How do you make your own yogurt with a culture? I mean, it's not hard. Yogurt making is pretty easy. If you're interested in it, you can Google or YouTube and find probably 1,000 videos on making yogurt that are more descriptive. What setting should an HVAC unit be set on? Would it be on auto or in the on position? I mean, it's not what setting should it be on. It's unique to the house. So your HVAC should do two things: heat or cool, and we're going to classify that as one thing, right? So basically regulate the temperature. And number two, dehumidify the air. And where mold will grow is when the air is not being properly dehumidified. So your HVAC system should be set up in such a way where your relative humidity in your house stays below 55%, ideally even 50% or less, because that's going to reduce the accumulation of humidity that will allow for mold growth. So it's not whether you have it in an auto position or an on position. It's just how efficient is your HVAC system at doing the job of keeping your home dehumidified. And so one of the simplest things that you can do to understand the answer to that question is to get on Amazon and buy some what are called hygrometers, and they measure humidity, and you can put these in different rooms of your home and just keep an eye on the humidity level and monitor it over time. And if it's staying below 55%, then your HVAC job is doing a good job of keeping that humidity under control. If you've got 65% humidity in one room, 50% humidity in another, like now you have an answer as to this room's not being properly dehumidified, and you can start asking, maybe there's a water penetration. Maybe it's like in a bathroom when you take a shower and all that moisture builds up and there's no fan being used or the window's not being cracked to allow for that moisture to escape. That's going to build up humidity. So it's not the setting of the HVAC. It's whether or not it's actually effective. It's the right size and whether it's effective. And there's a lot of other variable factors with HVACs that can lead to moisture accumulation that are too complex to answer in the next few minutes. What do you recommend to treat Lyme disease with multiple co-infections? It depends. When you say multiple co-infections, and if it's been there a while, are you sure it's Lyme, or is it? What I see, Ruby, is a tremendous amount of people that have a Lyme diagnosis that would do just fine if they would change their diet. I mean, I've seen that in my career. I've been practicing now almost 25 years. I'd say 300 or 400 times I've seen really easy a Lyme case come through the door where they had another doctor they were seeing and diagnosed with Lyme and took a bunch of antibiotics, still felt horrible, still had positive Lyme tests. And when we just changed their diet, they felt better. And so I understand that a big part of the way we beat Lyme, you may need an antibiotic and you may need a natural antibiotic agent. There may be other things you need to support your body, but generally speaking, if your diet, you always have to start with diet. If you don't start with diet, you're not giving your body the foundational tools that it needs to even have the nutrients to heal and repair, or to give your immune system the strength that it needs to fight. So I know that's not an answer to your question, but it's a better answer to your question in the sense that if you haven't investigated those things, then it doesn't matter what you treat the Lyme with. You're not going to succeed treating Lyme by eating a poor diet and living a life that's not conducive to supporting your immune system's strengths, because ultimately what beats Lyme isn't the doctor. What beats Lyme is your immune system, the strength of your own body, the innate intelligence within it. And if you nourish that, your body can win. Could mold be a contributing factor to Parkinson's? Yes, in a very big way. I talked about this a few weeks ago, Ron, if you want to check out one of my recent videos where I broke down mold toxicity, and I actually talked about the different neurological diseases linked to mold exposure, and Parkinson's is definitely one of them. Is Epsom salt soak just as good a detox as a sauna? It can be if the water's hot enough and you're sweating in it and you tolerate it well. It can be a good way to go about it. what do you recommend to treat the toxin, the T2 toxin, after I've removed myself from the mold? So after you've removed yourself from the mold, you don't have to treat the antibody to the toxin because you're no longer going to be exposed to the toxin. So your immune system's going to quit making antibodies because there's no more exposure. Your immune system's only going to make antibodies, IgE antibodies, to the current acute exposure to that toxin. So those toxin levels will on their own start to decline as you take out or as you get out of the mold. Now, there are certain things you can do to support yourself, right? Again, recovering from mold exposure and the toxins, protein, eating enough protein, 1 gram of protein per pound of body weight, of lean mass body weight, is a good place to think about where your protein should be, because protein is going to provide a building block for the healing and the repair process for a lot of the amino acids that go into recovery. And this is an area that I see a lot of people are doing well in all other parts of their diet, but they're under eating their protein and they don't have the capacity to rebuild their tissue and to heal and repair from the past exposure. But there's nothing you need to detox. You don't have to detox from IgE antibodies. They will naturally subside on their own when the exposure goes away. Nutrients supporting histamine stability, vitamin C, quercetin, bromelain, nettle are all good things to take in that regard. Vitamin B6, vitamin B1. So, I mean, there's a lot. There's several that both support histamine stability in the cell itself, but also help with the degradation of histamine once it's been produced. What about UV lights? So you're asking me if UV lights can be used in what regard for mold recovery? I mean, UV lights have been used to treat mold growth on skin for decades by dermatologists that know what they're doing. So in that regard, UV lights are an effective way to help in that way. But UV lights are not a substitute for sunshine. I would say sunshine would be your better option. Yeah, so you mentioned mycotoxins being stored in fat cells. Is that different than mold colonizing? Yes. Remember, mycotoxins are non-living toxic byproducts of mold. So when you're in moldy environment, you're breathing those toxins in, and those toxins are getting into your fat cells, they're getting into your tissue, and that's what detox is about, trying to push those out. Whereas colonizing mold is the mold is growing on you or in you. And those are two very different things. Now, if you're colonized with mold, that mold that's growing on you and in you can make mycotoxins that then are stored in your fat cells. And that's why I said it's important for detox that you, number one, get out of the mold, and number two, get the mold out of you. And then number three, detox the non-living mycotoxins from your body, in that order. Can mold and candidal toxins cause OCD? Yes. So you have a history of iron overload. Kirsten, do you have hemochromatosis? And so you're worried about taking vitamin C because it enhances iron absorption from your food. If the answer is yes, taking higher doses of vitamin C is not really going to contribute to your iron overload tremendously. But if you're really wanting to be cautious about it, then when you take your vitamin C, take it 1 hour to 2 hours away from heavy iron containing foods, especially the plant-based foods. The heme iron from animal meats is going to be absorbed with or without the vitamin C, but it's the plant-based irons that vitamin C is going to enhance the absorption of. So if you take your vitamin C away from those foods, you're not going to have to run into that problem. Can dehydration cause elevated creatine kinase and CRP? Not typically, no. Now, aggressive exercise that might dehydrate a person could be a reason why we see elevations in CK and CRP. The question would be, did you get a CK isoenzyme test done? So CK, creatine kinase can be a marker for muscle cells being damaged, your skeletal muscle cells. But CK, there are isoenzymes that are made by your brain and your heart, and those can be teased out from testing. And those, so if you have an elevated CK, you should tease those out, because it could be brain, it could be heart, and not necessarily muscle. But dehydration is not really going to be a major cause for that in and of itself. Oh, UV lights on. How about UV lights for air purifiers? I mean, they're not air purifiers. They're the problem with UV lights. You can buy them. They're hundreds of dollars. If you're trying to budget your money and say, okay, is this worth the bang for the buck? The answer is probably no. UV light is not going to stop mold from growing in your house. I've got a good friend who's a mold inspector. He pulls UV lights out of HVAC systems all the time that have mold growing on them. So they're not going to stop mold from growing if the moisture levels are high enough. Now, UV lights can offer some degree of purification, but it's minimal depending on the size of the UV light and the type of system that you have. So usually UV light is used in conjunction with other things, like the UV light is used in conjunction with a good filter and with a properly installed HVAC system as a preventative. But in and of itself, the power of these UV lights is not strong enough, in my opinion, to serve as a standalone air purifier. You would want to use it in conjunction with others. Any input for postpartum women? Supplements to help restore hormone balance in the rest of the body. Good quality ultra nutrients is what I would recommend for postpartum women. And then also I would recommend test for sure. The worst nutritional deficits I see clinically are women who just had babies. And it's because you just grew a human in your uterus, right? And that required a vast amount of nutrients to do so. And as a general rule of thumb, the baby, it sounds a little maybe tacky, but the baby's a big parasite just saying, thank you, mom. Thanks for sacrificing yourself for me. And so mothers are left commonly in a state of nutritional deficit postpartum. And this is one of the reasons we'll see postpartum problems, depression, among other things. So testing them to determine what specifically they need to recover, because if they're also going to be breastfeeding, now we're talking about an extra 400 to 500 calories a day that they're going to be distributing away from themselves to that baby. And that includes all the nutrients that come with those calories. So testing becomes very, very important, because outside of that, as a generalization, ultra nutrients and ultra omega, the premium 2 grams a day of omega-3 and a good quality multivitamin, multimineral, that's where your best bet is. I live in an open pit coal mine, and there are a whole lot of particulates in the air that seem to collect in windowsills and turn fuzzy like mold after a while, if not cleaned out regularly. Is it possible that mold uses those particles as a fuel source? Yeah, mold can grow on dust particulate, very much so. What I would consider you do, or urge you to do, is take a sample of that and send it out to like Eurofins and have them do a microscopic analysis to make sure it's not mold, and that it's, if it's just coal debris, that's not great, but it isn't mold, right? So a microscopic exam could help to determine that for you. Which nutrient should we have tested? So I guess this is kind of a follow-up to that other question. All of them. You're talking about malnutrition and nutritional deficiency. You want to check them all. Mel, can we put a link up for None Your Business? I guess that's your handle, your YouTube handle. Can we put a link up for that individual on nutritional testing? So yeah, there's 40 essential nutrients, and then there's other, what we call cofactor nutrients, that are important to measure. And this, we're going to put a link up to a test that you can read more about, but that's what I would recommend. Okay. So we nailed it today, an hour and a half. Look, I hope this was helpful. Don't forget, if you're looking for support, if you're struggling with autoimmunity and chronic inflammation and you've been to doctors and you don't know what to do because they're not helping and the medicines aren't helping, we have a support system for you. You come over to glutenfreesociety.org, sign up there, put your name and email there, and I'll send you a ton of free information on how to navigate autoimmune and chronic inflammation naturally with diet and lifestyle change. Also, you can text us. You can text, and we'll put that up to you as well. We'll text you the information if that's the way you prefer. But anyway, come visit us over there if you need more support. We're also here every Thursday at 12:30 minus holidays for live Q&As. And we're here every Tuesday at 6 p.m. Central Time for a crash course on a variety of different topics around health, nutrition, and autoimmunity. So we're your support system. Don't forget to come back. Remember, our goal and mission is to save 100 million lives, and the way we do that is we share. So if you found this information helpful, copy and paste and send it to somebody that you love. Hit the share button and definitely hit that like button and help us get this information out into the hands of the people that need it the most. Thanks so much for tuning in, and we'll see you next week. Have a great weekend.